Clemson, South Carolina. My name is Erin, and this is my co-host, Buddy.
Good morning, Clemson. Today we will start out with a simple fact, that summer is quickly approaching, and that means break out the bikinis, music, and relax.
That's right, Buddy. And about the music you're listening to, I've noticed that over the past few years, as MP3 players and iPods have become more popular, that people have been listening to more and more music. Sometimes I can even hear the music just by standing around them, and I know that they wouldn't even hear it if a bus was about to hit them.
Now you're right, Erin. This behavior is really becoming more and more popular. Now I can't imagine this is becoming helpful to their hearing.
Well, Buddy, I heard from my friend Gina that hearing damage can begin just after 5 short moments of listening to music at 100% volume.
Really? Now what else did she say?
Well, you're in luck, Buddy. We have a new report today called Older Ears on Younger Bodies from Gina.
Wow, I can't wait to hear this.
Thank you, Erin and Buddy. Yes, today we will explore the impacts that headphones have on particularly young generation. We will talk about and explore the effects and impacts that listening to music for extended periods of time, as well as high volume intensity, is damaging the ears and of the world's future.
So first off, Gina, tell us, is it really dangerous to listen to loud music like this so close to your ears?
After assessing the general public, trends have been spotted in the younger generations to show an increase of early signs of hearing loss and impairment. In fact, according to Hearing Alliance of America, they reported that 15% of college graduates have equivalent or worse hearing loss than their parents.
I don't get it, Gina. Why do kids do this to themselves?
Well, Buddy, that seems like a good question, and it can be answered in multiple ways. First, some people just don't realize that the risk they are putting themselves in and the harm that it is causing. Second, people are only worry about the now, trying to block out other noise. Whether it's walking around campus, at the bus stop, or even in class, people are not showing concern for their hearing. And lastly, some may also believe that the product they bought, whether MP3 player or headphones, the manufacturer designed it to be safe, and don't believe that they are at risk.
Well, if the people aren't going to do anything about it, who will?
Right. Like who should take care of the issue? The people? The government? Headphone companies? MP3 player companies? The music industry? Who?
Well, in one instance, the headphone company created their product to not allow the consumer to listen to music past a certain level.
So the headphone companies took on the problem?
Well, not exactly. A lot of people fought them because they believe it took away their own liberty and control of how loud they wanted to listen to their own music.
But if people don't know the harm and refuse help, like from the headphone company, then what can be done?
Well, reports such as this, educating the public is key for this issue. Listening to loud music is a behavior and you can't change it with easy medicine or a law.
Well, Gina, take a moment and tell us, what would you say to educate the people about the fact that loud music is harmful to your hearing?
Yeah, I don't see people receiving it that well. I mean, it's not like they're going to stop listening to music.
Bingo, Buddy. People are not going to stop listening to music, so educating them on safe ways to partake in listening to music is how it should be done. 80% volume for 90 minutes a day is proven to be safe according to time, in the same way that 70% volume for 4 hours a day, or half hours a day, is also safe, done in the same study.
Good to know, Gina. Thanks. Well, we're going to take a short break, but then we'll come back with Gina for a further explanation on the importance of altering this behavior.
Hello, my name is Brooke Ingram, and I'm here to talk to you about an important issue that plagues American society: headphones. How often are we walking along and we want to talk to somebody, but we can't? Why? Because of their headphones. Well, this is no longer a problem thanks to an amazing product called the Inceptor. The Inceptor is a small handheld device that allows your voice to be broadcasted through people's headphones. All you do is push this red button, speak into the device, and your voice will be sent to the headphones of the person you are closest to. Let's take a look at some examples. See your friend down the hall cooking brownies, but she has in her headphones the Inceptor. See the nerd studying and you have a math question. The Inceptor. Hottie down the hall always has his headphones in. Not a problem. The Inceptor. You can do all this and more with the Inceptor, and it can be yours for the low price of $49.99. But wait, there's more. If you call in the next 10 minutes, we will include 2 Inceptors for the price of 1. So call now, 1-800-455-2277. The Inceptor. Be heard.
Welcome back! If you are just tuning in with us, we have Gina here for our segment, Old Ears and Young Bodies. we will continue with the explanation of the impact this has made on the younger generation, who is damaging their hearing from overexposure as well as volume intensity when using headphones.
Right you are, buddy. This behavior is fairly new with the newer technology. Therefore, government intervention is very much lacking, so the impacts go from harming the individual as well as people involved in accidents caused by hearing impairments.
With the government not taking a stance on this issue, are there any other organizations that are realizing this issue?
Yes, a very popular nonprofit organization called HEAR really works at educating and making more people prepared on the issue.
HEAR? Here?
Yes, Hearing Education and Awareness for Rockers. They really exemplify the public healthcare system. They cover goals of promoting, protecting, and preventing.
Ah, the 3 Ps.
Yes, the public health is really the preventative side of healthcare. And right now, they need to be taking over this issue. You see, in the future, when this younger generation ages, they will flock toward the healthcare system to fix their hearing problems. So the more the public health field can do today, the less healthcare we will have to do tomorrow.
But what's wrong with just letting the healthcare system shove hearing aids in everybody's ears in the future and save time by making efforts to change the behavior today?
Well, buddy, it saves a lot of money. Think about it. In the future, they will have to improve technology of hearing aids, educate more people in the industry, as well as produce more hearing aids. Also, based on the law of demand, as quantities demanded increases, the price increases. Therefore, people would be forking up the money to fix a problem that could have been prevented in the first place if they had just heeded the precautions. Not to mention, many accidents are caused by miscommunication or lack of hearing, and taking any preventative measures to reduce these potentially life-threatening accidents is worth the time to promote and educate.
Wow, Gina, I really enjoyed hearing from you this morning.
Me too. I'm sure people are really going to think twice now when they start blaring music into their ears.
Great. I hope people will see that you only get one pair of ears in this lifetime, and it's their own responsibility to take care of them.
Well said, Gina. Well, that wraps up our show for today.
Thanks so much for staying tuned, and we'll hope to see you soon, Clemson.